Dental Laboratory, Immediate Loading Implantology, Design and Construction of Temporary Thread-Reinforced Resin Bridges. Titanium through-hole cylindrical abutments, height 3 mm, height of the edges 1.8 mm. These fixed temporary resin bridges are used in immediate loading surgery and in all temporary bridges of average duration. The design and construction of these semi-finished temporary bridges is always done based on the clinical and prosthetic case and the patient's situation. We would like to indicate the procedures to the dentist and dental technician with a few examples. First example, thread-reinforced resin lower bridge. There are many personal ways to adapt the steel orthodontic thread. However, it is important to make them malleable by heating them over a flame. We began this bridge by passing the steel thread through the holes in the 4 titanium cylindrical abutments as if we were threading pearls. Both ends of the wire are bent to prevent the abutments from slipping off. The first cylindrical abutment is screwed onto its analog. Bend the 2 threads with pincers at the same time until you have put all the cylindrical abutments one by one into a passive position. Check the spaces available with the mask. You can unscrew the screws and check the passivation of the framework. Mask the thread with paint and finish the bridge in resin. Finished and polished resin bridge. Second example, temporary bridge derived from the patient's old removable prosthesis. In edentulous patients with a complete removable resin prosthesis, you can usually use the old dentures and transform it into a fixed thread reinforced resin bridge. Maxillary arch. 1. The patient's prosthesis in resin. 2. 6 implants are inserted and the mini transfers are mounted. 3. The prosthesis was excavated along the gingival crest and tested in the patient's mouth. 4. You further file down the resin in the points of pre-contact with the mini transfers. 5. With the patient closing their mouth while taking the impression shows the habitual occlusion of the prosthesis. 6. Before casting the model, insert the analog in the mini transfer, dirty the transfer's head with glue and insert it into the impression. Pour the model carefully with a quick setting plaster. 7. Plaster model with equator analogs and titanium through-hole cylindrical abutments and orthodontic thread of 0.8 mm. removable prosthesis adapted with the position mask. 8. Finished prosthesis reduced to the size of the fixed temporary bridge. 9. Thread reinforced resin temporary bridge fixed in the patient's mouth. Third example, mandibular arch, the patient's removable prosthesis. 1. Surgery, 4 implants inserted and 4 mini transfers mounted. 2. Impression taken with the prosthesis excavated from the gingival area with the equator analogues in position. 3. Through-hole titanium abutments joined with 0.8 mm steel wire and the implant adapted on the model. 4. Polymerized resin in hydroflask. Finished lower prosthesis transformed into a Toronto-type temporary fixed bridge. 5. Lower thread reinforced resin bridge, fixed in the patient's mouth at the end of the session. 6. 2 immediate loading thread reinforced resin fixed bridges were obtained from the old removable resin prosthesis. Bridge fixed in the patient's mouth at the end of the session. 7. X-ray checkup. Fourth example. Immediate loading mandibular arch. Immediate loading semi-worked temporary bridge project with the teeth to be extracted. In this lower bridge, we had to design a gingival support base as extended as possible to give a secure position in the patient's mouth after the extraction of all their teeth and the insertion of the implants. Laboratory steps. 1. Models in the articulator. 2. Design of the gingival base extended as much as possible so as to give placement and stability to the plate in the patient's mouth on the gum after the insertion of the implants. 3. The plaster teeth are removed from the model and resin teeth are mounted. 4. Mounting teeth in wax. The gingival edges are largely extended. 5. Keep the labial border very thick and sturdy. It will be useful later during the work. 6. Mask with teeth in place, self-curing resin will be cast. 7. Semi-worked resin temporary bridge. Gingival support base largely extended. Indented rim prosthesis to make a useful space in the area where the implants will be inserted. 8. Semi-worked bridge used as an individual impression tray, with the articulation locked in the patient's mouth with red resin. 9. Insert the analog of the mini transfer. Dirty the transfer with glue and insert it into the impression. 10. Cast the plaster carefully without shaking it to keep the analogues in position. Leave it to harden. Prepare the other plaster and make the model. 11. Remove the red resin. Make a position mask. 12. Check and thoroughly clean the contours of the analogues of any plaster so as to mount the through-hole cylindrical abutments of the correct height perfectly in position. 13. Heat the steel thread. Mount the first titanium abutment on the analog and secure it with its screw. Bend the wires and complete the reinforcement. 14. Fill the space between the titanium cylindrical abutment and the plaster with wax so as to avoid any resin infiltration in the peripheral groove between the plaster and the titanium cylindrical abutment. 15. Eliminate the resin from the internal lingual part in order to keep the labial gingival edge complete and robust. 16. To make the reinforcement sturdier, a thicker steel thread was added along the arch. The reinforcement is masked with paint. 17. With the thick and sturdy labial edge, the entire arch is maintained to make it easy to adapt the block and put it into place with the mask. 18. White resin pushed inside lingually and polymerized. 19. The external gingival edge is blocked out and easily eliminated, as it was previously kept large for ease of work. 20. Finished thread reinforced bridge. Seegers inserted with their opening in the direction of the divergences. Through-hole titanium cylindrical abutments without extra-grade indented rim. When unable to mechanically build through-hole cylindrical abutments with extra-grade indented rim, if necessary and in order to facilitate the insertion of the bridges, the dental technician with the burr should create the extra-grade indented rim finished work, doing it for each abutment in the correct position according to the divergences of the OT equator analog. With the extra-grade indented rims created, the bridge is completely passive without retention. With the Seegers mounted in the right direction, the bridge fits perfectly in position without any trauma.